Assalamu alaikum, this is Dr. Hasna with Hasna's Anatomy, and today we're discussing the anastomosis around the elbow joint. Guys, before I get started, I request you all to subscribe to my channel. This very complex topic is about to become a piece of cake. So let's get right into it. So basically, what is an anastomosis? I've already explained to you. For instance, this is an organ, this flower is an organ, and there is this vessel or this strain that is trying to get to the flower. The basic aim is to get your water to the flower so that it can be water and it can remain fresh. All right, so what happens is, in case this connection, some bee hive comes in the middle and prevents this water from going to the flower and the flower can easily die, what happens is there are other connection. There's a collateral connection from this place to the flower in many different kinds of ways. These are the collaterals that eventually, even if this gets damaged, they can choose an alternate path and get to your flower, and your flower is ready and blooming. Similarly, in your body, your limbs are supplied by these anastomosis, not just limbs but many areas. But in case of upper limb, if we're talking about getting the blood from your heart all the way to your entire arm and forearm. So in case of the anastomosis around elbow joint, which occurs in the elbow region, your brachial artery is connected to the radial and ulnar artery. Brachial artery is the main artery of the arm, whereas the radial ulnar arteries are the main arteries of your forearm, right? And if brachial artery gets damaged right here, is our limb going to undergo necrosis and die? Because that's it, you don't have any blood supply. No, it won't. And this is because the anastomosis will save it. So that is what we're going to study today. Which branches of the brachial artery are anastomosing with which branches of the radial and ulnar artery. So the branches are going to form that connection that is required in case there is a blockage of the pathway. First, we'll talk about the branches, and then we'll just add the branches to the condyles of the humerus. So this is the humerus. The humerus, basically this anastomosis occurs around the condyles of the humerus, anteriorly and posteriorly, on the medial and on the lateral condyles. All right. I just want you to remember these branches first. The brachial artery is responsible for giving the profunda brachii artery, which goes to the back in the lower triangular space with the radial nerve, and it enters the posterior compartment of your arm. Now, the profunda brachii artery gives a anterior descending branch, all right, and a posterior descending branch. Anterior descending branch is also known as the radial collateral branch, because once the profunda brachii terminates as these two branches, the anterior branch is what will accompany the radial nerve. All right, so anterior descending branch or radial collateral branch, posterior descending also known as the middle collateral branch. All right. Then the brachial artery gives this artery known as the superior ulnar collateral artery. This was the best friend of the ulnar nerve. This always accompanies the ulnar nerve behind the medial epicondyle. If you remember, the ulnar nerve pierced the medial intermuscular septum to enter the posterior compartment, right? I hope you can remember these little relations. These will help you a lot. So superior ulnar collateral artery, and then it gives a inferior ulnar collateral artery. Now let's talk about the branches of the radial and ulnar artery. The radial artery gives this branch called the radial recurrent branch. Whenever there's a word as recurrent, means it will go back from where it came. So this artery will go upwards rather than going downwards in its normal direction. It'll go upwards because it's the recurrent and it is the radial recurrent. All right. Then we have the ulnar artery. Now, ulnar artery is where the story gets a little tricky. First, ulnar artery gives an anterior ulnar recurrent, and then it gives a posterior ulnar recurrent. That's pretty simple. Anything that's ulnar is the medial side. And then the ulnar artery gives this huge branch known as the common interosseous artery. Now, the common interosseous artery says that everybody has an anterior and posterior, so I also want to make an anterior and posterior. So common interosseous, what it does, it gives an anterior interosseous, and it also gives a posterior interosseous, which goes behind, obviously, because it's known as posterior means it lies behind, right? It goes in the back. Now, the posterior interosseous artery is going to give an interosseous recurrent artery. So it gives a, what is this? The interosseous recurrent artery. So guys, if you can remember all of these branches, I assure you the anastomosis of elbow joint is now going to be just simply words. All right. And now we know that if there is any injury over here, if there's any blockade in this pathway, these branches, collaterals, will open up. the anterior, posterior, inferior, superior ulnar collatral, these all will somehow communicate with the branches of the radial and ulnar arteries, like the recurrent, trochus recurrent, common introchus, and make sure that the blood flow is restored and your hand and your forearm is supplied with blood, right? Anastomosis of elbow joint is going to be occurring on these condyles, all right? So let's talk about what comes from above and what comes from below, meaning which branch of brachial artery is going to come from above and which branch of radial and ulnar artery is going to come from below. All right, the first thing I just want you to know, anything that's medial means some ulnar artery is going to be involved, and whichever is the lateral side, your radial artery will be involved. That makes sense. And from below, what do you think is going to come from ulnar arteries branches? Anterior ulnar or posterior ulnar recurrent? It's anterior, right? So it's going to be anterior ulnar recurrent from below. We're talking about the medial condyle, guys. So if it's the medial condyle, then it has to be something related to ulnar. So it has to be one of these ulnar collaterals, right? And I already told you superior ulnar collateral is going to go behind. It's going to go in the posterior compartment, piercing the medial intermuscular septum with the ulnar nerve. So obviously it can't be this. So it has to be the inferior ulnar collateral artery coming from above. Here IUC, inferior ulnar collateral artery, in front of the medial epicondyle. What about the posterior side of the medial epicondyle? Behind the medial epicondyle, from above comes, inferior is used, so superior ulnar comes from above. This is a branch of the brachial artery once again. And from below we have, what do you think? It's going to be the posterior ulnar recurrent. Now let's talk about the lateral condyles. Lateral condyles, now since we've used these, let's just get these out of the way. So our topic is going to be on the lateral side. Whatever story is going to be, these are the branches that are left. So in front of the lateral condyle, anteriorly, from above comes which branch of the brachial artery? So guys, there's an anterior and posterior descending. So what do you think will come in anteriorly? Obviously the anterior descending branch of the profunda brachii artery, which is a branch of the brachial artery. What about from below? Which branch will come? The radial recurrent branch, obviously, because that is one artery it gave. Radial recurrent is coming in front of the lateral epicondyle and anastomosing with the anterior descending branch. All right. Then we have behind the lateral epicondyle, from above comes anterior descending is done. So obviously posterior descending. And from below will come whatever is left. What is left, guys? I remember this posterior interosseous artery. It's lying posteriorly and then it gave an interosseous recurrent. So that is the only thing that makes sense to fit over here. So it is the interosseous recurrent coming from below. And that is your anastomosis of elbow joint. It is that simple once you've learned the branches. And this learning the branches is the only difficult part. So guys, that's all you need to know about the anastomosis. I really hope that made sense. Thank you so much for watching.